You're in your 30s and still suffering from acne? You're not alone. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist, and today, let's talk about hormonal acne. So hormonal acne, or AKA adult female acne, is something I see all the time in my practice. In fact, I probably see more adult women with acne than I do teenage girls. And it's this term that we use to describe acne in adult women over the age of 25. Either women that have experienced acne since teenage years or who've really never broken out until they hit their 20s, 30s, 40s, even perimenopausal. And it can be super frustrating. We know that acne affects our self-esteem, self-image, our quality of life. And it's been estimated that up to 30% of adults, men and women, will continue to experience acne into their adulthood. And this is something that's near and dear to my heart because I also personally suffer from hormonal acne. So we use the term hormonal acne because for most women, there is this cyclic component of acne flaring around their period. And that is one of the biggest drives behind acne occurring in adult women. And as you can see later on this video, we'll talk about some of the treatments that's really tailored towards managing and moderating that hormonal flare. But classically, adult female acne will occur most commonly on the face, but can also happen on the body, and tends to have this U distribution on the lower jawline, which I like to think of as like the beard distribution in men. Now, some women will say, gosh, I know exactly when I'm about to get my period because my acne will flare. And for some women, they may have some acne at baseline and then may intermittently flare a little bit around their period. But the quality and the type of acne is slightly different than the ones that we typically see in teenagers. In teenagers, we tend to see more clogged pores. In adult hormonal acne or adult female acne, there tends to be this more cystic-like acne, like deeper acne that just doesn't want to come to a head, and often will not only be painful, red and inflamed, but often will leave dark marks or red marks after the acne has resolved. Now, as far as who tends to get hormonal acne, it happens to all of us, but usually in women that have a strong family or personal history of acne are more likely to experience hormonal acne. Sometimes starting or changing up methods of contraception can be a trigger for hormonal acne. And similarly, pregnancy or postpartum, those times where you experience hormonal changes often can be a trigger for acne in adult women. And similarly, risk factors, not causes, but risk factors that can contribute to the acne includes, diet. If you eat a lot of high sugar, high glycemic index, inflammatory foods, and as always, stress often will make acne worse. So why is hormonal acne happening? One of the components is hormonal stimulation of your oil glands. The androgens that are elevated during our monthly cycle is going into the skin and stimulating our oil glands, creating these deeper cystic-like acne that just don't want to come to a head. But also, even in women who don't experience those monthly flares and just feel like you have acne all the time, addressing that hormonal component is really one of the key parts when we are treating adult female acne. So let's talk about the treatments. What do we do? What's really most effective is a combination of topical things and oral medications when it's appropriate. And when we're using topical treatments, it's really not that different in treating the average acne. My go-to recommendations, again, are still going to be benzoyl peroxide, like I talked about before, a topical retinoid as well. And this is going to be helpful, and it still is effective. Even if the acne is deeper and cystic, it can still be helpful in preventing acne, helping with hyperpigmentation. And I recommend this in general for adult women who really don't have severe acne, may not be interested in taking anything orally, but just want to be on something to help to really tackle those maybe occasional flares. In addition to benzoyl peroxide and a topical retinoid, azelaic acid here can be very helpful, especially the prescription strength that can help with treating the acne, but also helping with hyperpigmentation, which often can be very commonly seen with the deeper cystic acne that we see in adult women. And in general, because of the nature of hormonal acne, it is best treated with oral medications. In addition to the topical things that I mentioned, I usually really love the combination of the two. Often in women with more severe acne, really getting on oral medications can be life-changing. And the two that dermatologists most commonly prescribe are oral contraceptive pills and spironolactone. These two medications are very effective because they really address that androgen flare, that hormonal flare that we get with our monthly cycle, to really tamper that so that we don't get those deeper cystic acne. So let's start off with oral contraceptive pills or birth control pills. There are essentially, I think 3 or 4 that are FDA approved actually for hormonal acne. But how they work is temper the hormonal flares, but also when you take birth control pills, it actually increases these proteins in our blood that will bind to free testosterone hormones and basically decrease the amount of androgen hormones that's floating around in our bloodstream from stimulating our oral glands and thereby minimizing those deeper acne that we see. There are some limitations to oral birth control pills. It's not ideal for women over the age of 35 who smoke, who have a history of clotting or stroke or high blood pressure, because it can increase the risk of those when you're over 35. And also I find that, it's a very personal thing. A lot of women don't often like the way they feel on birth control pills, especially if you also have a history like migraines. For myself, it was a big trigger for my migraine. So this is something where I just recommend talking to your prescribing doctor about what would be the best for you. But if you're not interested in a birth control pill, don't like the way you feel, or may not be able to due to those risk factors, then spironolactone may be a wonderful option for you. So spironolactone is probably my most prescribed medication for hormonal acne. I would say this is probably a first go-to for most dermatologists, and has become a very effective treatment for hormonal acne. How spironolactone works in treating hormonal acne is that it blocks the androgen receptors in our oil glands, basically prevents again that stimulation of our hormones, then downstream the deeper cystic acne. And it's very, very safe. We have a lot of great studies on the efficacy as well as the safety of spironolactone, even for long-term use. Now, with most hormonal treatments, whether it's birth control pills or spironolactone, it can take up to 3 monthly cycles for you to start seeing benefits. It's a little more of a delayed gratification. It is not safe during pregnancy. This is one thing that we do recommend not taking if you're pregnant, but it is safe to take during breastfeeding or lactation. Because it can suppress your milk production, I recommend to lactating moms first establish a good milk supply before you start taking this medication. But dermatologists as well as the American Academy of Pediatrics do recognize spironolactone as a safe medication to take for treatment of hormonal acne during breastfeeding. So some of the common side effects for spironolactone, it is not a contraception, so you don't want to get pregnant, but it has very similar side effects as birth control pills. So some breast tenderness, some irregular periods. These usually normalize as you continue with your treatment. Some lightheadedness, some frequent runs to the bathroom. But I would say for the dose that we as dermatologists prescribe, most patients are fine. Very few will stop the medication because they're getting constantly lightheaded or dizzy. Spironolactone is not recommended in individuals with a history of heart or kidney disease, but it is something very safe to take long-term, even in women in their late 30s, 40s, and 50s, as long as you're not planning to have kids. Obviously, speak with your prescribing doctor to figure out whether spironolactone is appropriate for you. But like I said, this is my most commonly prescribed oral medication, highly effective for adult hormonal acne. In my practice, I like to do topical things along with spironolactone. I think that is like my go-to. I hope you found this video to be informative. Leave a comment below and let me know what your experiences have been if you've been on either of these two medications. Again, you can follow me on my social media, on Instagram as well as TikTok. I will see you guys next time. Thanks for watching.